Picture this. You just started your first day at a hospital as a new hire. You're nervous about securing a coach at orientation sessions to learn about new challenge colleagues. There's a ring of an alarm and the action around you starts. One of the patients has fallen and is injured. Other nurses and staff of different disciplines come running in to see what the extent of the fall was and how they can help the patient. Being a new nurse could cause you to be stuck in a dilemma regarding your part in this process. This challenging scenario emphasizes the need to identify nursing sensitive indicators of quality and use them to facilitate multidisciplinary teamwork. The first of these indicators you will read about today is patients fall with injury. Completing this presentation will teach you about this indicator, why it matters, and your role as a nurse to reduce falls and match fall data. You will also learn how this indicator is used in the system of evidence-based practice and continuing quality improvement. Knowing this will help you better work with your multidisciplinary team to keep patients safe. To begin, to begin with, let us learn more about this key quality indicator. It is changes in the structure, process, and outcome of nursing care measures cause qualitative indicators of nursing sensitive quality. This, this enables us to quantify and evaluate nurses' unique contribution to organizational performance, patient safety, quality of nursing care, and patient satisfaction. The National Database for Nursing Quality Indicators is a national database that collects such measurements from hospitals that participate. It permits hospitals to compare their performance and point to areas that can be improved. This training addresses a patient falls with injury indicator, a high priority nursing care quality and safety measure. It indicates the incidence of potentially preventable falls and their injury. A patient fall occurs when our patient descends to the floor unprepared for the descent with or without injury, while falls with injury result in moderate to severe injury. This indicator is of such significance because falls can cause harm to patients, ranging in severity from pain and distress to complications, extended hospital stays, and loss of trust in the healthcare team. Falls also have serious organizational consequences regarding higher financial costs, compromised care quality, reputation loss, and patient satisfaction. Our professional and ethical responsibility as nurses is to protect our patients from unnecessary harm whenever possible. Because we work more hours providing direct patient care, we're in the best position to intervene to prevent the risk of fall through accurate assessment, individualized interventions, and education of patients and their families. Meanwhile, we are responsible for documenting and reporting every time a fall occurs so that patterns of contributing factors and potential corrective strategies can be identified in the data analysis. By focusing on this key indicator of nursing sensitivity, we hold the potential to impact patient outcomes positively. Let us describe our organizational process for collecting and reporting fall data and how that data is utilized to enhance quality. In the case of a fall, the nurse must file an incident report in the computer based health record by the end of that shift. The report captures key details such as the date, time, and location of the fall, the mental and physical status of the patient immediately preceding and following the fall, existing environmental or situational risk factors, the resulting injuries, and initial interventions and treatment given. Reports need to be completed as accurately and objectively as humanly possible. Once entered, this unit level data is consolidated into a centralized falls dashboard that hospital leadership and quality improvement staff can view continually to identify problem patterns and trends in care. Aggregate fall data, including rates and severity levels, are discussed quarterly during interdisciplinary quality council meetings and emails to all clinical staff. Unit specific fall rates are also prominently displayed on huddle boards to remind everyone daily and facilitate collective accountability. Using real time dashboards combined with regular reporting keeps keeps fall prevention at the top of everyone's mind across the entire organization. To maximize the potential of such data, reporting and responding to faults must be done with a quality improvement mindset. That means continuously working to document faults consistently, completely, and accurately to uphold data integrity. It means close data analysis to ascertain the story it conveys regarding gaps in process, communication, or risk prediction. Most of all, it means applying that knowledge to guide meaningful practice changes that would benefit or mitigate potential future falls. The question, so how is an organizational focus on the falls with injury, nursing sensitive quality indicator expressing evidence based practices in actual practice settings? This means that nurses should work with the latest studies and best practices that are recommended by experts in preventing and responding to falls. The indicator data indicates the most crucial risk factors and care areas that need improvement. From this information, educators, quality improvement professionals, and nurse leaders can design evidence based processes, procedures, and educational programs to standardize and improve practice. As a point of example, the information can dictate a need to employ a new instrument to assess for risk of a fall, to more often take rounds of nursing, or to employ a post fall protocol that is validated. The information can also point to a need for environmental issues such as cluttered rooms or inadequate lighting that must be addressed by an interdisciplinary team. In many, like the pharmacists, facilities managers, or physical therapy. In many cases, indicators of quality lead to the creation of formal, evidence based guidelines or clinical pathways that spell out precisely what nurses and other team members need to do in a particular set of situations using the most up to date science. Such guidelines often use patient care technologies such as video monitoring, bed alarms to prevent falls. By connecting indicator data to evidence based practices, healthcare organizations create a learning environment called improvement culture that keeps patients safer. In conclusion, the patient falls with injury nursing sensitive indicator impacts each member of a healthcare organization from bedside staff to leadership. By tracking and evaluating fall data, we gain compelling evidence of the safety and quality of nursing care that, in turn, is used to inform evidence based strategies to avert falls and improve outcomes. As nurses, we also have an opportunity to take a leadership role in reducing preventable falls in our day to day practices. That means staying vigilant around fall hazards, working closely with patients and multidisciplinary team members, critically self assessing our practice, and embracing a continuous improvement mindset. For you, as a new nurse, one of the most impactful things you can do is to approach each intervention with a safety mindset. Thoroughly evaluate patients for the risk of fall and be sure to use individual precautions in high risk. Always check the environment, making sure they're uncluttered, and speak up when there is a misfall or a risk for fall. And you, as a new nurse, has new eyes that are invaluable, and your active engagement in quality improvement is crucial to providing the safest possible care. Thank you for your commitment to this important work. Feel free to reach out to us at any time if you have more questions. Thank you.